Cancer, the silent pandemic, and how AI is changing survival forever. Cancer is not a future problem. It is happening right now. Every year, millions of people across the world receive a diagnosis that changes everything. Families are shaken, plans are interrupted, lives are divided into before and after. According to global health organizations, cancer remains one of the leading causes of death worldwide, affecting nearly every country, every culture, and every socio-economic group. But what makes cancer particularly dangerous is not just how common it is, it's how silently it can grow. Many forms of cancer develop quietly, without symptoms, spreading at the cellular level long before a person realizes something is wrong. By the time warning signs appear, the disease may already be in advanced stages. This delay in detection is one of the biggest reasons survival rates vary so dramatically. Now imagine a world where cancer is not discovered late, but early. A world where abnormal cells are detected before tumors form. A world where a simple scan analyzed by artificial intelligence can identify patterns invisible to even experienced specialists. That world is not science fiction. It is beginning to exist. Artificial intelligence is transforming medicine at a speed few anticipated. Unlike humans, AI systems can analyze millions of medical images in minutes. They can compare patterns across massive global datasets. They do not get tired. They do not miss subtle pixel-level changes due to fatigue. And they are becoming extremely powerful tools in early cancer detection. One of the most significant breakthroughs has been in medical imaging. AI models trained on thousands, sometimes millions of X-rays, MRIs, CT scans, and mammograms can now detect microabnormalities that are nearly invisible to the human eye. In breast cancer screening, for example, AI systems have demonstrated the ability to reduce false negatives while also decreasing false positives. That means fewer missed cases and fewer unnecessary biopsies. For patients, that translates into earlier intervention and less anxiety. But imaging is only one part of the revolution. AI is also transforming pathology, the microscopic examination of tissues. Traditionally, pathologists analyze biopsy samples manually under a microscope. This process requires years of training and immense focus. AI tools can now assist by scanning digital slides and highlighting suspicious areas instantly. Instead of replacing doctors, AI acts as a second set of highly trained eyes, reducing oversight and increasing confidence in diagnoses. Another area where AI is making a difference is genomics. Cancer is fundamentally a disease of DNA mutations. Modern sequencing technologies generate enormous amounts of genetic data. Analyzing this data manually would take lifetimes. AI systems can process complex genetic patterns and identify mutations linked to specific cancer types. This allows doctors to personalize treatments, a field known as precision oncology. Instead of using generalized chemotherapy, patients can receive therapies tailored to their tumor's specific genetic profile. That increases effectiveness and can reduce harmful side effects. However, one of the most powerful applications of AI may not be in hospitals at all, but in prevention and risk prediction. Machine learning models are being trained on lifestyle data, environmental factors, family history, wearable device metrics, and routine blood tests to estimate cancer risk earlier than ever before. AI can detect patterns across populations that humans simply cannot see. For example, subtle combinations of inflammation markers in blood tests, combined with sleep irregularities and heart rate variability from wearables, may indicate increased risk. While these systems are not diagnostic tools on their own, they can prompt individuals to seek medical screening earlier, and that is where the true power lies. Early action. Early-stage cancer survival rates are dramatically higher than late-stage survival rates. For many cancers, detecting the disease at stage 1 instead of stage 4 can mean the difference between a 90% survival rate and less than 20%. AI does not cure cancer, but by accelerating detection, refining diagnosis, and personalizing treatment, it increases the odds that medical intervention happens when it can be most effective. There are also AI-powered liquid biopsy technologies under development. These tests analyze fragments of tumor DNA circulating in the bloodstream. Using advanced algorithms, AI can identify cancer signals from a simple blood sample, potentially before symptoms arise. Some companies are developing multi-cancer early detection tests capable of screening for dozens of cancers simultaneously. If these technologies continue to improve and become affordable, they could fundamentally change public health screening worldwide. Beyond diagnosis, AI supports treatment planning. Oncology involves complex decision-making, tumor stage, location, patient age, genetic profile, comorbidities, previous treatments, and potential drug interactions. AI systems can analyze clinical trial databases and recommend evidence-based treatment pathways personalized to individual patients. This does not replace oncologists. It empowers them with data-backed insights. AI is also improving radiation therapy precision. Algorithms can map tumors and surrounding healthy tissue with incredible accuracy, allowing radiation to target cancer cells while minimizing damage to healthy organs. This reduces side effects and improves quality of life during treatment. Drug discovery is another revolutionary area. Traditionally, developing a new cancer drug can take over a decade and cost billions of dollars. AI accelerates this by predicting how molecules will interact with cancer cells before physical testing even begins. This dramatically reduces research time and cost. Some AI-discovered drugs are already entering clinical trials. However, while the technology is powerful, it is essential to be realistic. AI is a tool, not magic. It depends on high-quality data. It requires regulation, validation, and human oversight. Algorithms can inherit biases if datasets are not diverse. Privacy concerns must be addressed. Medical decisions should always involve qualified healthcare professionals. AI should support doctors, not replace them. For individuals, the practical question becomes, how can AI help you right now? First, AI-powered health apps can help track lifestyle factors that influence cancer risk, sleep patterns, exercise frequency, diet quality, and exposure to harmful habits like smoking. While these apps do not diagnose disease, they help maintain awareness. Consistent data tracking can reveal patterns over time. Second, wearable technology combined with AI analysis can detect abnormal physiological changes. For example, unexpected drops in oxygen saturation, irregular heart rhythms, or sudden weight changes can prompt medical evaluation sooner. Third, AI chat systems can help people understand medical terminology, prepare questions for doctors, and interpret general health information, but never replace professional consultation. Being informed empowers better conversations with healthcare providers. Fourth, AI can help individuals stay updated on screening guidelines based on age, gender, and family history. Many people miss recommended screenings simply because they are unaware of timing recommendations. Smart reminder systems can reduce that gap. The future of cancer care will likely be a hybrid model. Human expertise amplified by machine intelligence. Doctors will continue to make final decisions. Compassion, empathy, and ethical judgment cannot be automated. But pattern recognition at scale, that is where AI excels. Imagine a healthcare system where routine annual blood work is automatically analyzed by AI for hidden risk signals, where imaging scans are double-checked instantly, where treatment plans are cross-referenced with the latest global research in seconds, where drug development cycles are shortened dramatically. That future is approaching faster than most realize. Yet technology alone is not enough. Public awareness matters. Access matters. Education matters. AI tools must become accessible globally, not just in wealthy healthcare systems. Otherwise, disparities could widen. Cancer remains one of humanity's greatest health challenges. But unlike previous decades, we now have computational power capable of analyzing biological complexity at unprecedented scale. AI does not eliminate uncertainty. It does not guarantee survival, but it increases clarity. It reduces blind spots. It strengthens early detection, and in diseases where timing is everything, that can mean the difference between life and loss. The most important message is not that AI will save you. It is that AI, combined with medical professionals, preventive care, and informed action, can dramatically improve outcomes. Awareness, screening, early detection, personalized treatment, continuous monitoring. Artificial intelligence is becoming a critical ally in each of these areas. The war against cancer is not over, but for the first time, humanity is fighting with tools powerful enough to see what was once invisible. And sometimes, seeing early is what saves lives. What makes this technological shift even more important is the psychological impact it has on patients and families. Fear often comes from uncertainty. When someone hears the word cancer, the first reaction is panic, largely because of the unknown. Artificial intelligence, when used responsibly, reduces uncertainty by offering clearer data, faster analysis, and more structured insights. For example, Predictive AI models can estimate how a tumor might respond to certain treatments based on thousands of similar historical cases. This doesn't guarantee outcomes, but it provides probabilities grounded in data rather than guesswork. That alone can help doctors create more confident treatment plans and help patients feel more informed about their options. Additionally, AI-driven global databases allow researchers from different countries to collaborate in real time, accelerating discoveries that previously took years. Patterns that might have remained hidden in isolated hospitals can now emerge through shared machine learning systems trained across continents. The result is a more connected medical world where knowledge compounds faster than ever before. While AI is not a miracle cure, it acts as a force multiplier for human intelligence, turning scattered information into actionable insight. And in a battle where time, precision, and knowledge are everything, that advantage can make a measurable difference in survival and quality of life.